after surgery, what is the usual time scale for someone to find out if their operation has gone smoothly and actually find out results in terms of has all the cancer been removed? Was it the size it was expected to be? What was expected?
So again, it depends on an individual patient and what was their finding before operation. But if I take sort of average patient with usual cancers, which are usually on a smaller side and usually operated by keyhole operation, then it is expected that whenever we do operation, apart from removing the part of the lung which has the cancer inside, we are also sampling certain lymph nodes inside the chest around the big airways. So, for example, there are certain criteria when the patients are referred for chemotherapy, like if the tumor is more than 4 centimeters, or if there are certain lymph nodes involved. So these patients might benefit from seeing oncologists and having discussion about possible treatment by chemotherapy, which will enhance the chance to be completely cured from lung cancer in the future. In general, people who have a cancer which is less than 4 centimeters and there is no lymph node involved by the cancer, then they usually don't need any further treatment, and the surgery is the only treatment that the patient needs, which will be followed by 5 years at least follow-up after the surgery as such. So once we send the specimen for examination by histopathologist, they will look at the specimen, not only how it looks macroscopically, but also under microscope. And what we are most interested in is everything as expected before the surgery from the imaging, meaning is it only the lesion which we are aware of, or is there a certain involvement of the lymph nodes? We are also interested if the whole tumor was removed. So for example, if there is a tumor which is involving one of the bronchi, we want to make sure that once the cancer is removed, that the bronchi is also clear from the cancer. But I have to say, in most patients, we are able to remove the tumor completely. And in most patients, the findings are as expected as it was before the operation. But in general, it's between 7 and 10 days when we know the final result. And these results are then discussed with the patients when we see them in the clinic. So once we send the specimen with the lymph nodes for examination, we usually have the final result in about 7-10 days from the histopathologist, when we see what was the success of the operation by removing the tumor completely, and also if the lymph nodes are clear or not. And we usually see the patient between 3 and 6 weeks after operation to clarify the final result, so we can confirm with the patient that indeed surgery was the only treatment which they needed, or if there's a need for further assessment for further treatment by oncologists. So we usually perform a chest X-ray just to clarify that there are no unexpected findings, for example, large amount of air around the lung or larger effusion which will need some drainage or so. And also clarify how the patient is with coping after surgery, how much they can walk, how is the pain around the wounds, and so on and so on. And after this initial assessment, after this initial outpatient appointment, we then follow up the patient for the next 5 years. And in our unit, we usually perform CT scan just to make sure that the cancer is not coming back.
So for many people after their surgery, when they don't need any further treatment, they will have follow-up appointments with their surgeon and scans perhaps every 3 months or 6 months, and then does it move on to a yearly pattern? How often are people followed up and how long for?
There is not complete consensus in the UK as such. The follow-up is performed by CT scans. Initially, the number of CT scans is more frequent, so it's mostly 6 monthly for 2 or 3 years. Mm-hmm. And then for the rest 2 or 3 years, it's performed by CT scan but just once a year. But in general, it's usually CT scan follow-ups, usually more frequent in the beginning and only annually later on for 5 years as such.